CC9 Awareness of Mental Health Conditions and Dementia by the World of Work for WOW Homecare employees. Mental health is about how we think, feel, and behave. It encompasses our emotional, psychological, and social well-being. It influences how we handle stress, relate to others, and make choices. Our mental health affects our daily life, relationships, and even our physical health. Good mental health doesn't mean being happy all the time. It means being able to manage a range of emotions and situations effectively. It means having the resilience to cope with life's ups and downs. Resilience helps us recover from setbacks and adapt to change. Mental well-being is a broader concept. It includes our mental health, but also our sense of purpose and fulfillment. It encompasses our mental health and our sense of purpose, our relationships, and our overall satisfaction with life. It's about feeling good and functioning well. When we experience mental well-being, we feel good about ourselves and our lives. We have a sense of meaning and belonging. We can cope with challenges and enjoy our relationships. We are able to contribute to our community and work productively. It's important to remember that mental health is just as important as physical health. Both need to be nurtured and maintained. Both are interconnected and contribute to our overall well-being. Taking care of our mental health helps us lead a balanced and fulfilling life. Mental health conditions are common and can affect anyone. They are often characterized by changes in our thoughts, feelings, and behaviors. Anxiety disorders involve excessive worry or fear that interferes with daily life. Examples include generalized anxiety disorder, panic disorder, and phobias. Mood disorders are characterized by significant shifts in mood, such as depression and bipolar disorder. Psychotic disorders like schizophrenia involve a disconnect from reality, with symptoms like hallucinations or delusions. It is important to remember that these are just a few examples, and each condition exists on a spectrum. Each person's experience is unique. Dementia is not a single disease, but a group of symptoms that affect memory, thinking, and social abilities. It is a broad term that encompasses various conditions, including Alzheimer's disease, vascular dementia, Lewy body dementia, and frontotemporal dementia. Each type of dementia affects the brain differently, leading to a range of symptoms and challenges. It is caused by damage to brain cells, most commonly due to Alzheimer's disease. Other causes can include strokes, brain injuries, and certain neurological conditions. The damage interferes with the brain cells' ability to communicate with each other, which affects thinking, behavior, and feelings. Symptoms of dementia can vary, but often include significant changes in memory, thinking, and reasoning. These changes can be subtle at first, but gradually become more noticeable and disruptive. Memory loss that disrupts daily life, such as forgetting recent events or important dates, is a common early sign. This can lead to repeated questions and reliance on memory aids. Difficulty with problem solving and familiar tasks, like following recipes or managing finances, can also occur. This can make everyday activities increasingly challenging and frustrating. Confusion with time or place, sometimes getting lost in familiar surroundings, is another common symptom. This can lead to safety concerns and the need for supervision. Challenges with communication, such as difficulty finding words or following conversations, can make social interactions difficult. This can lead to feelings of isolation and frustration. Dementia is a progressive condition, meaning symptoms worsen over time. The rate of progression can vary widely among individuals, influenced by factors such as overall health, age, and the specific type of dementia. The rate of progression varies depending on the individual and the type of dementia. Early diagnosis and intervention can help manage symptoms and improve quality of life for those affected and their families. Mental health conditions and dementia can significantly impact individuals and their families. Daily living. Simple tasks like dressing, bathing, or eating can become difficult. Relationships. Communication challenges and personality changes can strain relationships with loved ones. Physical health. Mental health conditions can increase the risk of physical health problems. For instance, anxiety can lead to sleep problems or exacerbate existing conditions. Emotional well-being. Individuals may experience a range of emotions, including sadness, frustration, fear, and isolation. It is important to remember that the impact of these conditions extends beyond the individual. Family members and caregivers often face significant challenges as well. Early identification of mental health conditions and dementia is vital for several reasons. First, early intervention allows for timely access to treatment and support services, which can improve outcomes. Second, early diagnosis of dementia, while not a cure, can allow for interventions that may slow the progression of the disease. And third, early identification allows individuals and families time to plan for future care needs and make important decisions. Recognizing early signs is crucial. These signs can be subtle and vary greatly between individuals. As mental health conditions or dementia progress, care needs will inevitably change. It is crucial to adapt care plans to reflect these evolving needs. Individuals may require increased support with more personal care tasks, such as bathing and dressing. Proper medication management becomes increasingly important as the condition progresses. Caregivers need to be equipped to manage potential behavioral changes, such as agitation or wandering. In the later stages, the focus of care may shift to ensuring comfort and dignity. Care plans should always be person-centered, focusing on the individual's unique needs, preferences, and abilities. Navigating the complexities of mental health and dementia care can be overwhelming. It is crucial to provide clear and accessible information and connect individuals and families with appropriate support services. Connecting with local support groups can provide invaluable emotional support and practical advice. Advocacy organizations like Alzheimer's Society and Mind offer a wealth of information, resources, and advocacy support. Respite care services offer temporary relief for caregivers, allowing them to take a break and recharge. Remember, you play a vital role in connecting individuals and families with these essential resources. Treating individuals with mental health conditions and dementia with dignity and respect is paramount. Focus on what individuals can still do and encourage their remaining abilities. Create a safe space for individuals to express their feelings and concerns without judgment. Engage individuals in activities that they find enjoyable and stimulating, fostering a sense of purpose. Remember, behind every diagnosis is a unique individual with their own life story, interests, and preferences. Person-centered care is an approach that places the individual at the heart of all decisions. It involves working collaboratively with the individual, their family, and other healthcare professionals. Empowering individuals to make choices about their care and maintain as much control as possible, recognizing and respecting individual preferences, values, and beliefs. Active participation in activities and decision-making is crucial. It promotes a sense of purpose, independence, and self-worth. Accessing appropriate healthcare can be challenging for individuals with mental health conditions and dementia. Stigma surrounding mental health can prevent individuals from seeking help or disclosing their condition. Individuals with dementia may struggle to articulate their needs or understand medical information. Healthcare professionals may not always be adequately trained to recognize and address the specific needs of this population. We must work to break down these barriers and ensure equitable access to quality care. Several pieces of legislation protect the rights of individuals with mental health conditions and dementia. These laws are designed to ensure that everyone, regardless of their mental health status, is treated with dignity and respect. They provide a safety net for those who might otherwise be vulnerable to neglect or abuse. The Mental Health Act of 2007 provides a legal framework for the assessment, treatment, and care of individuals experiencing mental health crises. This act ensures that individuals receive the necessary medical attention and support during their most challenging times. It also outlines the rights of patients and the responsibilities of healthcare providers. The Equality Act of 2010 protects individuals from discrimination based on protected characteristics, including disability, which encompasses mental health conditions and dementia. This act is crucial in promoting inclusivity and equality in all areas of life, from employment to education and beyond. It ensures that everyone has the opportunity to participate fully in society. The CARE Act of 2014 emphasizes person-centered care and promotes well-being, ensuring that individuals receive the care and support they need to live fulfilling lives. This act highlights the importance of tailoring care to meet the unique needs of each person, recognizing that everyone's journey is different. Familiarizing yourself with relevant legislation is crucial. Understanding these laws empowers you to make informed decisions and advocate effectively for those in your care. It also helps you navigate the complex landscape of mental health and social care services. This knowledge allows you to advocate for the rights and needs of the individuals under your care. By being well informed, you can ensure that they receive the support and protection they deserve, helping them to lead more fulfilling and independent lives.